Hi, this is Mike Protack here to talk about a few political issues this year that are important for the state of Delaware and for our country. Recently, healthcare has come up, again, with a new president who thinks this is a very important issue, and so do I, and I think most people do. But let's take a look, even though this is a bit politically oriented, at a non-political solution to what we think healthcare can be for Delaware and for the nation. It can certainly be a very pointed argument, but let's remember one thing. When you go to the emergency room or to a doctor's office, nobody asks if you're Democrat, Republican, or Independent. They just want to know if you have healthcare insurance, if you have coverage. So let's talk about that for a minute. What are the things we want to have for healthcare in Delaware and the country? Let's make it real simple. We need patient-centered healthcare, where you, the patient, the human being, is the focus on everything that happens in that healthcare system. Next, let's make it hassle-free. We all have complicated, busy lives. The last thing we want is the nightmare of dealing with insurance companies that don't seem to care and an unresponsive government. We want hassle-free insurance. That's critical. Last thing, your health insurance should fit your lifestyle, not a one-size-fits-all cookie-cutter government approach where politicians are out of touch in Washington decide what you get. It should be your choice, your lifestyle. Very important. Now, what's next in healthcare? As we start to design a plan that has universal coverage, what are we looking for? Three very important concepts that are just terribly, terribly critical to make this thing work. It should be based on wellness. Right now in the United States of America, we have a plan based on sickness. We treat problems, incidents, illnesses. We need to redirect our health care towards wellness. If we do wellness, we get something called productivity. Productivity for a workforce, for an employer, is terribly critical. If your workforce is not healthy, they are not producing. We need that. Last thing is security. Healthcare was designed 50, 60 years ago where you got employed by one company and literally stayed there forever. Well, that doesn't happen much anymore. People are telling me, and my own experience is, you need flexibility. You might be self-employed, you might be employed by a big company, you might be an entrepreneur. You're certainly willing to take on financial risks, but you shouldn't have to take on healthcare risks. So we need something that addresses security needs. Now, what else can happen? Integral in all this healthcare reform, again, addressing you the patient, you the human being, you need to have choice. Again, there's some talk of having a public option, which would be, again, a cookie-cutter plan, a one-size-fits-all from Washington, which would gradually take over your healthcare choices. We think that's wrong. You should have personal choice. We need competition. Now you ask why? Why have competition? The key effort there is we need to have coverage that will take care of catastrophic expenses, which can bankrupt you, but also have premiums that are low enough on a monthly basis where you can afford them. The only way to do that is through competition. Last thing is responsibility. We can ask a lot of businesses, we can ask a lot of the government. We have to ask a few things of ourselves. Most of us know that about 70% of our health care comes from chronic disease. We also know 60 to 80% of those diseases can be prevented by our own actions. So you have to be responsible. We can control healthcare costs, but not without responsibility. So where all is this going to lead us? Now, we'll be talking in the weeks and months to come of some of the things, the weaknesses in the President's plan, some weaknesses from other plans, and of course what we think should happen. But in the end, what we really want to have happen is a balanced, common sense approach to healthcare reform in the United States and of course in Delaware. We'll be laying out the good parts, the bad parts of everybody's plan. But in the end, what we need to do is address something very, very important to all of us. A healthcare system where everyone is in, no one is out, and everyone pays their fair share. If we do that, we can control costs, have a healthier workforce and a more productive workforce, and treat people as human beings, not just as a number. Thanks for tuning in. We'll have more of these sort of conversations in months and weeks to come. Please tune in. Thank you.